In the isolated province of Kwango, in the southwestern Democratic Republic of Congo, life seemed to follow its usual course, marked by simple routines and constant challenges. However, in October 2024, a disturbing phenomenon began to emerge. Families living in small, scattered villages started reporting cases of high fever, persistent cough, and severe headaches. Initially, many believed it to be a common flu, something the body could overcome with rest and natural remedies. But something was wrong. The symptoms progressed rapidly, leading to extreme weakness and, in many cases, death within days. Communities began to realize they were not dealing with an ordinary illness. The disease seemed to primarily affect women and children, with an alarming frequency among teenagers. In no time, more than a dozen families had buried their loved ones in brief, grief-stricken rituals. The village of Pansy, one of the hardest hit, became an epicenter of panic. With no nearby hospitals, residents relied on rudimentary clinics, which soon became overwhelmed. Most deaths occurred at home, far from any medical assistance. The situation ignited fear and despair, fueled by a lack of concrete answers. People began to wonder if they were being punished or if something malevolent had invaded their lands. Whispers about supernatural forces gained traction as science, often distant from these communities, seemed unable to offer explanations or solutions. As the communities struggled to cope with the growing impact of the disease, local leaders sent urgent appeals to authorities in Kinshasa. Reports indicated that the deaths were multiplying, but the response was slow. For many, each passing day without help felt like a step closer to being forgotten. On the horizon, there were signs that aid was on its way, but the population did not know what to expect. For them, survival depended on holding on to hope, even amid growing uncertainty. After weeks of alarming reports from Kwango, health authorities finally responded to the call. A team of specialists from the Ministry of Health and the World Health Organization, WHO, was dispatched to the region. However, the journey to reach the affected villages revealed one of the first challenges: limited infrastructure. Poor road conditions, combined with the rainy season, made the trip slow and dangerous. Upon arriving in Pansy, the specialists encountered a visibly frightened and distrustful population. To many villagers, the arrival of outsiders, even if they were compatriots or health professionals, was met with skepticism. Rumors quickly spread, with some fearing that the doctors themselves might be carriers of the disease or agents of external forces with dark intentions. Meanwhile, the specialists began collecting samples and recording symptoms. High fever, dry cough, intense headaches, and signs of anemia were consistently identified among those affected. Local authorities reported that the disease seemed to progress unpredictably, with some people succumbing within days, while others showed slow recovery. The medical team attempted to implement basic measures to contain the spread. Isolating the sick was one of the first recommendations, but this met resistance. In a region where community and social proximity are cultural pillars, the idea of separating the sick was almost impossible to accept. Furthermore, limited resources made any attempt to establish effective quarantine infrastructure unfeasible. Another critical obstacle was the shortage of medications and equipment. Many local clinics barely had pain relievers, and the health professionals present lacked the training necessary to handle an emergency of this magnitude. The lack of potable water and basic sanitation exacerbated the problem, creating ideal conditions for the proliferation of diseases. Gradually, efforts to gain the population's trust began to show results. Community leaders were integrated into initiatives, helping to spread information and dispel rumors. However, progress was slow, and the death toll continued to rise. Although teams were on the ground, it was clear that the response would be a test of resilience for both health professionals and the communities facing this new and mysterious enemy. As days passed, the devastating impact of the outbreak in Kwango became increasingly evident. The disease not only claimed lives, but also created a void of answers that heightened tension in the region. For specialists on the ground, the problem proved even more complicated than anticipated. Scientific investigations began with the collection of blood and water samples in an attempt to identify a common cause. Initial hypotheses pointed to possible water contamination or a new strain of a respiratory disease. However, laboratory tests returned inconclusive results, frustrating efforts to contain the epidemic spread. Meanwhile, the social impact of the outbreak intensified. Without a clear diagnosis, communities began seeking answers in traditions and local beliefs. Many associated the disease with spiritual punishments or actions of supernatural forces. Religious leaders and traditional healers took center stage, offering remedies and rituals that, while comforting, could not stop the deaths. This cultural tension further complicated the efforts of medical teams, who struggled to balance the application of scientific measures with respect for local traditions. How can we trust something we don't understand? Was the recurring question among villagers, reflecting the deep disconnection between rural communities and external interventions. Additionally, the economic impacts of the outbreak began to surface. With many falling ill or fearing to leave their homes, agricultural and commercial activities slowed dramatically. Entire villages entered a kind of informal social isolation, exacerbating shortages of food and essential goods. Despite the difficulties, efforts to educate the population on hygiene and prevention measures began to emerge. Simple messages, such as washing hands regularly and avoiding direct contact with deceased bodies, were conveyed by community leaders working in partnership with medical teams. Yet, with every advance, new challenges arose. Initial resistance began to transform into impatience and frustration as villagers saw little improvement. The death toll continued to climb, and for many, science seemed as powerless as traditional remedies. Nonetheless, early signs of organization and resilience began to appear, indicating that, despite the losses, communities were willing to fight for survival. As the outbreak progressed, medical teams, community leaders, and international organizations intensified their efforts to contain the disease. Despite the challenges, signs of progress slowly began to emerge, bringing a glimmer of hope to devastated communities. One of the first changes was the expansion of awareness campaigns. Messages about the importance of basic hygiene practices began to be widely disseminated. Religious and community leaders, once resistant, started collaborating, translating medical guidelines into a more accessible and culturally acceptable format. Protecting our families is our collective responsibility, they said, reinforcing the importance of preventive actions. With the support of international organizations, more resources began to reach Kwango. Hygiene kits, basic medications, and food were distributed to isolated villages. This assistance, though limited, helped reduce the disease's impact in less affected areas and provided temporary relief to critical regions. Meanwhile, specialists continued their search for the outbreak's origin. The hypothesis of water contamination gained traction, prompting teams to investigate local water sources and wells. Some villages were advised to avoid consuming untreated water, which, while difficult to implement, began showing positive effects in reducing new cases. At the same time, cases began to decrease in some areas. The drop in infection rates was met with cautious relief, but authorities warned that the battle was far from over. A small progress doesn't mean we can relax, specialists emphasized. Collaboration between science and local communities was essential to this progress. Although mistrust still existed, families began adopting simple measures, such as covering food and storing water in safer conditions. Small gestures that collectively made a difference. Even so, challenges persisted. In remote villages where aid had yet to arrive, the outbreak continued relentlessly. Inequality in access to care and resources highlighted the systemic difficulties faced by rural areas like Kwango. Still, for many, the signs of improvement were enough to reignite hope. Communities began reorganizing, and the feeling of despair gave way to a spirit of resistance. Though the path to overcoming the crisis was long, the first steps seemed to have been taken. As weeks passed, the mysterious disease that had plagued Kwango began to recede. The number of new cases dropped significantly, and the mortality rate decreased. For the affected communities, this was a much-needed relief, although the emotional, social, and economic impact remained tangible. Medical teams and specialists were unable to fully identify the disease's origin, but the outbreak revealed deep issues regarding the structural vulnerability of regions like Kwango. Investigations pointed to multiple factors, including contaminated water, poor sanitation conditions, and lack of access to basic medical care. However, without a definitive diagnosis, many questions remained unanswered. The crisis left important lessons. One of the most evident was the need to invest in infrastructure and public health, particularly in rural areas. The lack of clinics, medications, and trained health professionals was one of the biggest challenges during the outbreak. This crisis shows we cannot ignore the needs of the most isolated communities, whose specialists emphasized. Additionally, the outbreak highlighted the critical role of education and community awareness. The most effective changes came when residents began adopting simple preventive measures, such as hygiene practices and water care. Collaboration between medical teams and local leaders was a determining factor in progress, showing that science and traditions can work together during crises. Although the outbreak was contained, the scars it left would remain. Grieving families, disrupted communities, and economic losses marked Kwango's story. However, the resilience of its people was also one of its most remarkable legacies. Even in the face of adversity, communities demonstrated a notable capacity to adapt and unite. Finally, Kwango's story serves as a reminder to the world. Public health crises recognize no borders and can have global implications. Investing in the health and well-being of vulnerable communities is not only an act of social justice, but an essential measure to prevent future tragedies. As Kwango begins to rebuild, hope endures. Despite the losses and challenges, the crisis brought a renewed awareness of the power of collaboration and the importance of an inclusive and resilient health system.